All right, class, we're going to start on chapter 2, which is on page 35 for workforce and wellness. Going to break this up into two different little lectures here, two different little videos. So the beginning part of this, we'll kind of talk about taking care of ourselves on scene and with our patients, and then we'll talk about taking care of our mental well-being in the next one. So kind of starting this off here, some definitions that you all need to know is what is an infectious disease, what is a communicable disease, and what is a pathogen. A pathogen is any type of organism that is capable of causing an infection in our body. As far as a communicable disease is any type of infection that is able to spread from one person to another person. And an infectious disease is any type of organism that can cause some type of disease in our body. All right, so moving on with those few little definitions. Coming on down to, I did this a little different than your book did, so you may have to hop around just a little bit. This made a little more sense to me than the way your book kind of broke it out. So it shouldn't be too hard to follow along. So next we got routes of infection. It's just different ways that we can have infection get into our body. Your book talks a lot about like contact and learn the difference between direct and indirect. As far as direct contact means that whatever the infection is has to directly touch our body. If there is some type of like something in between of that infection in our body, say if like we had like a needle and maybe we did an IM injection into our patients and then we accidentally stabbed ourselves, that would be an example of an indirect contact because this needle was in between of that person and me. Another example would be like if I went up and coughed on you and coughed right into your face. That is not direct because there's air in between of that. I always tell students like an example of like direct contact would be like, you know, in Eastern Kentucky is like, I don't think I ever did this, but like, you know, when you cut yourself as a kid, you say you're going to be blood brothers or blood sisters or something like that. And it's like your body came in direct contact with theirs, and that's going to be direct contact. I don't know if any of y'all did that or not, but anyway, moving on. So different ways that an infection is spread. So we know it's spread through contact, direct or indirect contact. And then airborne, obviously, we're pretty familiar with COVID. And then foodborne. Foodborne, there's a lot of different kinds of pathogens that can come from food. The main ones we're kind of concerned about in EMS, you hear about E. coli outbreaks. E. coli is a bacteria, usually in contaminated water, and we get it on our food because somebody watered our food with contaminated water. E. coli can have long-term lasting effects that we don't get rid of. Another one you hear about is salmonella, and probably the worst one we could get is botulism, which we don't really see that much anymore. Botulism is usually caused because of some type of vegetable or something that was canned improperly. Botulism is actually spores, so it has to have the perfect environment to grow before it can become infectious to us. And then when we look at like vector-borne diseases, these we see from like ticks getting Lyme's disease in America, mosquitoes if you're going abroad for like malaria, different kinds of bats, rats if you go abroad, like even like dogs, like city dogs giving you rabies, or other kinds of animals giving you vector-borne through bites is what that is. Okay, probably review for all of you all, but anyway, want to touch bases on this. Coming over next, protection from a disease. So how do we protect ourselves? That's most important, right? There is, you'll probably all know this, but your employer is responsible for providing protection for you for whatever kind of disease you're going to be exposed to or pathogen you're going to be exposed to at your workplace. That's kind of overseen by OSHA. We all know this. So I kind of branched this off into three others. I had a kind of a hard time like putting them in specific boxes looking at your book, so I kind of took it down this one to immunizations. And immunizations, regardless of where you're at, is with politics or immunizations and whether to get immunized or not. In EMS, like we chose a field where immunizations are important. It's not just important for us, it's important for our patients. So when we get like an immunization for flu each year, which we're required to do for most jobs in EMS, that's not necessarily to protect me, it's to protect my patients. If I get the virus for flu and then I walk in the hospital and I'm around other people and I pass that to someone else that has immune compromised, or they're older, they're sick or something like that, like I did harm to my patient. So when we look at these different kinds of immunizations, yes, they're there to help us, but they're more so there to help us, not to help protect our patients, I guess. So flu is kind of something we do every year. COVID, we're all familiar with it because that's pretty recent. Hep B is just pretty standard if you're going to be in this field. Hep B, it's a hepatitis, it's a virus. It lives on the surface for 2-3 days. It is found in all kinds of bodily fluids. It's easily transmitted and it's easy to protect against. There is no cure for Hep B, so really good vaccine to have. Varicella is chickenpox. And then tetanus, usually people get a Tdap, has pertussis, and can't remember what else is in the Tdap. But tetanus is about every 10 years or so. Hepatitis A is usually found in fecal matter, non-treated drinking water. And then measles, mumps, and rubella. Most of us had this when we were a kid. If you're not sure if you've had these immunizations or you're not sure if they're good, you can always go to the clinic and you can get you a titer drawn, and they draw your blood and they will test your blood to see if you have antibodies for these particular types of diseases. Sometimes I put immunity up here because if you've had any of these, you probably built up some immunity to it. Immunity means you got some antibodies that are ready and prepared to fight these different types of diseases, like chickenpox. Well, I know when I grew up as a kid, we had pox parties. So if someone got the chicken pox, like you didn't go to school, and so you gave your friends the chicken pox, so they all came over to your house and you shared chicken pox, and you all just scratched a bunch and watched movies and had a good time. And then we built antibodies, so we never got chicken pox again. But anyway, I'll tell you all some little goofy stories that hopefully tie, some serious stories that hopefully tie to our lesson, so I don't get on a big tangent. So anyway, there's a lot of other immunizations out there too, you all. Especially if you're going to be traveling abroad, going to different places. Rabies vaccines are good if you're going to be going to a place where there's a lot of stray dogs. Yellow fever, malaria vaccine. There's a lot of different ones out there. Typhoid. But these are kind of the main ones we talk about for you EMS workers. All right, moving on. Here we go. We're going to jump over to PPE right here. This by no means is a full list of PPE that you can wear, and so you're obviously looking at some of this. It's a PPE, it should have been here. But for PPE, gloves is kind of our bread and butter. And I brought some gloves over here. I do have a table in front of me with quite a few things on it. So I'll kind of pull some of this stuff up as we go along. So gloves, I think everybody has probably taken EMT basic class. And y'all have hopefully practiced putting on gloves, taking off gloves. So if we have gloves on, some things I like to do with gloves, I like for my gloves to be kind of tight and working. Whatever your preference is just perfectly fine. Sometimes if it's a real bloody call, I'll put a medium size and I'll put a large size over top. That way when I get my patient out of the car or get them out of whatever scene they're in, and then get them into the ambulance, cut all their clothes off, I can take off a pair of gloves, and now I'm ready to start doing like vitals and starting IVs and doing stuff like that, and have a clean pair of gloves. But if you haven't did this in class yet, I should do this at some point just to make for sure. This is fake blood. Kind of smear this all over your gloves. This is really has a low viscosity, makes it a little bit harder. We'll see how well I do. But if you have blood all over your hands, you don't want to get it on you, right? So reaching down here at the base of the glove, putting your finger underneath. Oops, not doing very good there, am I? Putting your finger underneath and pulling that glove off, and then coming underneath of the glove here with a finger. And hopefully you come out without blood on your hands. So anyway, that's kind of putting gloves on, taking gloves off. Gloves should be worn on every call. As far as coming on down, gowns, we don't wear gowns on too many patients anymore. We used to wear them all the time with COVID. There are lots of different kinds of gowns. Get familiar with the gowns at your place. and how to put them on and how to take them off. This is called downing and doffing. It is a system to watch as far as like how to put your gowns on and then how to take them off without getting contaminated. For me, I find the hardest thing about these is the string that ties in the back. It kind of takes about 2 people. At least it does for me. I don't do gowns too often anymore since COVID has not been, well, it's still around, but since we don't put them on for COVID patients. As far as eye protection goes, you all, there's different kinds of eye protection. We see a lot of these, something similar or a full mask in the hospital. But these are just used for kind of like to cover your mouth and also to cover your eyes. Has strings that tie around back. You can also, most EMS workers you see will just have like simple safety glasses. So whatever you choose to do there for eye protection. Good thing though. Coming on down, masks are next. Different kinds of masks we have. This is a simple face mask. This is what we used to use all the time, and this is still kind of what we went back to. This doesn't prevent small particles from going through, but does prevent kind of larger particles from going through. Not sure if y'all can hear me with that on, so we'll take that off. There are N95s, which everybody's probably familiar with since COVID. This just keeps out a much smaller particle. So this one's kind of like a little duck bill. There's another one kind of like a little more open like this. These are both N95s, and they will protect you from tuberculosis, from COVID. So they filter out much smaller particles than just the simple face mask does. All right. Okay. Got some other PPE listed over here. So we'll kind of walk down this other part. As far as washing your hands, I always say wash, but washing your hands, this is probably the best thing you can do for you all to prevent the spread of disease with your patients. You should wash your hands after every patient. The textbook recommends 30 minutes, and like you all can see, like my fingernails are pretty short. That's where a lot of bacteria will hide. So if you're working in EMS, having short fingernails and making sure that you scrub on those fingernails on your hands, getting that dirt out from underneath of there. Okay, so 30 seconds is what your book recommends. Warm water. If you can't wash your hands after a patient, and they recommend using some type of hand sanitizer. This works fairly well. It doesn't kill all the little bacteria on your hands, but if you can't wash your hands after a patient, use some hand sanitizer. Then whenever you get to a sink or something, wash your hands. Okay, disinfectant wipes. There are different kinds of disinfectant wipes. We use these on the ambulance for the stretcher and for a lot of the equipment in the back, whether it be the seat or the cardiac monitor or whatever. This stuff is pretty toxic to your skin, so if you're going to use it, you should wear gloves while you're wiping stuff down. Your textbook says you should have heavy duty like industrial gloves for this. I personally have never used those. I usually just use the latex gloves that are on the ambulance. But definitely don't be putting this directly on your skin. It is tied with causing cancer if you keep doing it. All right. There's other kinds of disinfectant wipes too. There's also a gray top you can use. It's not quite as toxic. Doesn't kill as much bacteria. Those are kind of the two that we see at the hospital where I work most of the time. Other thing, I got sharps down here, you all. In AEMT class, this is going to be something new for you all. We'll talk about this in EMT class or an IV portion. As far as we have a much bigger risk now that we're starting to deal with needles, and we actually in EMS we're one of the few places that actually do recap and use needles quite often. A lot of the hospital use blunt needles or lure locks. So if y'all, hopefully you never have to recap a needle, but if you do, put your hands together here, and that way you can slowly kind of like put the needle in the cap as opposed to doing one of these. This is how we get most of our needle sticks. So if you do have to recap, put your hands together and just kind of recap the needle as such. All needles, whether they're recapped or not, need to go in a sharps container, okay? All right, what do we got next here? Biohazard bags. Anytime that we have blood, if it's just a tiny little bit of blood from like a glucometer stick or something like that, that's fine. We can throw that in the trash. But anytime we have a significant amount of blood, whether it be on a gauze or whether it be on sheets or clothes or whatever, we want to make sure that goes in a proper bag so that it's properly disposed of. This is a really small one. There's biohazard bags on all ambulances and all EDs. So let's just make sure we get it in the bag. Let's tie it off so that can be properly disposed of. I put some other stuff on here, turnout gear. This turnout gear, kind of thinking like bunker gear, so like for firefighters. Bunker gear is really good because it keeps liquids from going in, it keeps fire from going in, keeps a lot of smoke and chemicals from penetrating. I'm not a firefighter. I don't wear bunker gear, but it is a really good thing for keeping like pathogens away from us. When we talk about reflective gear, I didn't have a reflective vest, but I had my old EMS jacket. This was really dirty, but anytime that we're out on the highways, the DOT, the Department of Transportation, requires that we have some type of vest jacket on that is reflective so that people can see us going by, and that's for our protection and also for the other people too. I'm sure nobody wants to hit an EMS worker. So reflective gear, and also cold weather gear. Obviously in the ambulance I usually keep an extra jacket. If it's wintertime, sometimes I keep 2 or 3 jackets in case I end up having to go a long ways from the car for a patient or on a scene for a long time and outside. But make sure whenever you're working that you take enough equipment to keep you warm, to keep you dry in whatever kind of environment you're going to be in. Body armor. Body armor, there's not many EMS agencies where we live that use body armor. Our ambulance does have 2 bulletproof vests. I can't remember last time I've seen anybody wear one. They are really heavy. Some places I used to work back in Kentucky, we had some people there that wore them every day on shift. But those things are available if we want to wear them on the job. Okay. There's obviously lots of other PPE, you all. So this is by no means a full collection of stuff. Your book talks about PPE in kind of relation to highways and stuff you're going to see on the highway. A lot of you all are probably going to be working stuff like ski patrol or search and rescue, and so like this whole gamut of like PPE and equipment and your scene safety and stuff is going to be much more broader than what you learn in this class. Your book does mention helmets and boots. Helmets, mostly we're looking at like firefighters again, going in like buildings and protecting from something hitting their head. Most EMS workers just on the ambulance, we don't really wear helmets. But anyway, boots are really good. Anything that keeps fluid from going into your feet, whether it be puke, poop, vomit, blood, like whatever it is, you don't want it sitting in the bottom of your shoe and your foot just floating in it for a little bit. Okay, so I don't think it really matters a whole lot what kind of boots you wear, but something that doesn't allow water to penetrate, liquids to penetrate down into your feet. Okay. I think we're moving pretty fast here. I'm going to flop sides so you all can move over into here. So I put post-exposure up here for you all because there's a chance you might be exposed. I've been in EMS about 20 years. I've had 1 exposure. I had blood go into my eye from blood vomit. I don't know what it was, went into my eyes from an ET tube when we were working in cardiac arrest. I had glasses. They're sitting right up here on top of my head where they should be, right? But anyway, the patient did not have any diseases. She was tested for them and she was clean. But if you do have some type of exposure, follow your hospital's or your workplace's protocols. That's the first thing you do. There is prophylactic treatment for a lot of these different types of diseases that you might get, whether it be HIV or whether it be Hep B or something like that. Like they can start you, or rabies even. They can start you on like a series of drugs to prevent you from getting that disease if you have been exposed. Your book does talk about difference between exposure and contaminated. The difference is if you are contaminated, that means that pathogen is actually on you. If you've just been exposed, that means you have the potential of having that pathogen on you. Example, this would be like if I walked in a room with no mask on and I was standing on the other side of the room talking, and I walked out later and I found out that person had tuberculosis. That would mean I was exposed to tuberculosis. Doesn't mean that I am contaminated. Contamination means that that chemical or that pathogen is actually touching my body. Okay, so coming on over to scene hazards, other things to look out for. I meant to bring some stuff here with you to show you all, but vehicle crashes pose a lot of different kinds of risks for us. Ones that we think of a lot right away is like broken glass, sharp metal, airbags, unstable vehicles. These are some things that come to mind right away. And then lightning can be a concern for us. We usually, if you hear a lightning strike within 3 minutes, I may have this wrong. Anyway, be aware of lightning around, especially if there's water. Down power lines, kind of keep an eye out for your scene. If there's down power lines, then we need to get the electrical company to shut the electric off or secure that scene for us before we go tramping around on power lines. Crime scenes, if you're going to a crime scene, just make sure you stage before you show up to there, and then when the cops tell you it's clear, you can come on in. Most crime scenes that I've been to for patients, it's usually been to pronounce death on a patient, in which case you show up and they have the whole area kind of closed off. One person goes in, take the cardiac monitor. I'm not sure all places work like this, but take the cardiac monitor. They have you sign in your name, sign in your date, check your ID, and you walk up to the patient. Try not to set anything down, try not to touch anything, put the leads on the patient, print out a strip, confirm death, and then take everything back out, walk the same way out you came in. That's what I did most time for crime scenes, but what I'm really trying to get at for crime scenes is like the fewest amount of people have to go in and the fewest amount of disturbance to that scene is what we want to do with that. And we need to be documented. Whoever goes in and goes out, we need to have all that documented. Coming over to hazardous materials, there's lots of hazardous materials out there. I am definitely not an expert. I don't have my hazmat, but there is a book on your ambulance where you should be able to look up play cards. In the state of Colorado, vehicles aren't required to have these play cards if they have some kind of toxin on their vehicle, but a lot of them do. So anytime you show up and there's any kind of truck or anything that looks kind of industrial, kind of look for these, like those diamond shaped, you should know these from EMT, these diamond shaped play cards, and they have 4 different colors on them. We'll talk about those more later on. But in a nutshell, keep an eye out for hazardous materials. Think about which way the wind's blowing, think about which way the water's flowing. So if there's gasoline or whatever it is, we want to be uphill of water and upstream of air whenever we're approaching any kind of these scenes for hazardous material. Mass violence, more and more common these days. It kind of goes back to who is number one. EMS, we're always number one. Our partner's number 2, and everybody else comes after that. So if we have any kind of mass shooting or mass casualty type thing, always kind of take into account our safety first. Okay. As far as behavioral emergencies over here, behavioral emergencies are probably going to be your bread and butter we run into all the time. As much as I would tell you there's like a standard that you operate by with behavioral emergencies, there's not. I think almost every behavioral emergency I've been to presents me with a little bit different challenge that I'm not used to. My big takeaways for you would be to keep a distance and have police nearby. Your best observation of people having some kind of behavioral emergency is to stand back and observe them for a little while and see if they're a threat to you, and see what you need to do when you do come close to them. Talking to them from a distance, seeing how well they warm up to you. And my experience has been lots of times these patients will like kind of warm up to you and they'll just snap and turn the opposite way on you all of a sudden because of the way you held your eyes or the way your facial expression went. So I would tell you just to always kind of be careful, be on edge, have an escape plan, that sort of stuff, behavioral emergencies, and have PD, have police nearby also. Okay, I think this kind of wraps up the beginning of this chapter, and I'm going to stop here and then we'll watch another one that talks about the mental well-being of the EMT. All right.